if somebody comes in and they've got shoulder pain, and that is because they played baseball and they injured their shoulder, or they landed and sprained their ankle, or if they were deadlifting and they hurt their back. Those are the things that like are in my wheelhouse. That's when I really start to dig in on my path and start to work up these patients. So what does the workup look like? Well, an in-depth history. That is first and foremost. I always want to hear the story of how this pain happened. I want to go as far back as possible. And I also want to know all the injury and surgery history. So for example, someone comes in, they've got low back pain. Well, did you ever injure your ankles? Like I want to know the first set of injuries that happened, because recreating that story, that timeline is helpful in trying to understand the kinematics of how these things happened. Did somebody sprain their ankle a lot? And that resulted in some knee instability, and that resulted in excessive load on the SI joint, and now I've got an SI joint problem. Well, guess what? I can go in and I can address the SI joint, but if the knee instability that's actually coming from the ankle is never addressed, whether that's with me or whether that's with physical therapy or a different provider, then that low back, that SI joint is still going to continually be an issue because we're not addressing the deeper root cause, okay? So that history, going as far back as possible and walking through the entire thing. I want to know what it was like, what happened, what did it feel like then, how were pain levels then? Do you remember what made it better, what made it worse? And then in that, a key thing is what worked and what didn't work, okay? I want to know, did oral medications work? Things like Tylenol, ibuprofen, the standard run-of-the-mill stuff. Any muscle relaxers, were those used? Any opiates, were those used? Did you have any steroid injections? Any anesthetic injections? Did you have a radiofrequency ablation? Did you have surgery? Did you have physical? All of it. I want to know all of it. The reason is because that helps me in figuring out what may or may not be going on.